So we're discussing health sector, what we'd like to see as the candidates are campaigning on health. What are your thoughts? What's that thing you think anybody that becomes president tomorrow should deal with when it comes to health?
I think that it's easy to, build infrastructure. It's easy to build the big ones and put them in big cities where everyone can point out and say, but the issue of Nigeria really is that we have a huge population of people who live outside this big city, who have little to no education, little to no access to health facilities. And, I always question when people come to run for different kinds of offices, especially at the federal level, like if they understand Nigeria and its diversity and its difference, not only in culture, but also in the right word, topography, the geographical way it's, done. Like in the north, you have a small community of villages of people, and before you see another group of people or community, you have to go through, you have to drive, quite a distance. And sometimes you find that some of these people in one community, it takes them quite a distance to get to health facilities. So we have to look at the grassroots. We need to look at how to make sure that they find, even if it's basic primary health care, easily accessible to them. We need to put in more work at the grassroots. I know that politically it may not look good on paper because you cannot, people prefer to point out the big infrastructural projects, but if we don't help our people at that grassroots, that's when we will not see the growth that will come from that level to the federal level, put it that way.
I heavily agree with you, Miriam, because that is the problem. We play to the gallery in this country too much, like this big hospital that everybody is commissioning, and why? Why, when the ordinary Kogi man will not have access to that hospital? Why? Start from the grassroots. Start from up to down, not down, down to up, not up to down. Start to lift people up. And then you will start to see the change, this change that we are looking for in Nigeria. That's when that change will come. When you start going to... Look, I will give you an example. On New Year's Eve every year, I always have this traffic control because our area is jam-packed. So I hire boys, and I pay them well, and they control. So that place, there is never traffic. Or it's just very, everybody gets to where they're going. Because before, you will spend your New Year inside the traffic.
Wow.
And it is so someone came to our house on that New Year's Eve and said, that place, there was some traffic people there. I said, oh, Alakbole traffic control. I said, yes. I said, those are my boys. Hey, if things like this will work. So if people just pay attention to those small details.
Makes a whole lot of difference. Mike, talk about your own suggestion for you.
For me, I hear YK is about taking ownership. I hear you and I hear taking responsibility. Nigerians taking responsibility to make Nigeria work for Nigerians. But I also feel like there are many Nigerians that have no idea what taking responsibility would look like. There are many Nigerians that, based on how they've been brought up, it's a case of every option they turn to will be a negative option because that's the only thing they've seen. So the expectation is that for somebody to contest to be a leader, it means you have a vision of a better country for your people. And bringing it down, which is a question I asked the former commissioner, that what are the innovative solutions that can be homegrown for the people within the villages so that those that are in the riverine area, I don't want to hear there is no longer a campaign to say you want to build hospitals. We don't need you to build hospitals. If we get to the hospital and there's no blood, or we get to the hospital and there's no syringe, and people will still die because no doctor can take out the gunshots, the bullets in time. It's not about the facility. It's about the quality of care that your citizens get to receive anywhere around. So I want our candidates and aspirants to start talking about the fact that we are going to improve quality of the quality of life that the doctors and nurses get, so that they will be inspired to work better. We are going to ensure that there will be doctors that are in every riverine area that will be accommodation will be provided for them, so that they'll be able to provide not that building anything. They'll be paid well, so they will stay in I can take a doctor to somewhere in Zamfara that I know you might be coming from a city, but you are happy because you are there. You're able to render services to people
And you will
within
not
that
be
place.
kidnapped.
Innovation, yes.
That was one of my 3 things. So I have 3 things I wanted to tell whoever comes in, runs the country. Number 1, insurance. People must have access to health. Nobody pays for health 100%. They always have some kind of insurance that helps around the world. Nigeria, we try to have the NHIS that we have, but unfortunately, the Nigerian factor, we the people are also embezzling here, and they were hearing stories of this the money not getting to the providers. That's the doctors. Doctors are complaining. So there are private insurance companies here and there, but whoever comes in must find a way to ensure that the insurance policy works and the money gets to the doctor so they are well paid so they can treat treat us as people. That's number 1. Number 2, whoever becomes president must find a scheme to bring back Nigerian doctors around the globe. Many of them have reached retirement age. They're in their 50s, 60s. Some of them are ready to come back home. They're really tired of the system there. They want to come home. So create an environment to attract them home, because you can't stop doctors from leaving. It's impossible. But those who have lived there 30 years, 25 years, they've had a family, their children are in universities, they're no more living the American dream. They want to come and now create a Nigerian dream. Those are the ones you should attract. Find them. There are lots of them. There are thousands. And they don't want to retire there. They want to come home, to bring them home, help them, let them train those we have here in Nigeria, and let them and give them the enabling environment to do what they can do. That's number 2. Number 3, what you just said. A lot of doctors, I know that those doctors abroad say, I have family who are doctors, that if they decide to go to the villages, somewhere in one village that nobody will see you, you get much more money.
Yeah.
Because it's their incentives. They attract you because they want you doctors in those inner-nose communities. They need it. Same way here. If you need, let us give higher incentives, more money to doctors who are going to those communities that lack proper healthcare facility, and equip those places. We don't know the big structures. So if you come and tell us you want to build hospital, that's what we're looking for.
Yeah.
No matter how small it is, a 4-corner structure. Make sure there's amenities, make sure there's equipment, make sure there are trained workers, health workers. Just make sure that there's access to health. So I think that's what Nigerians want to see. There's data available. Yeah. Use the data to work. Don't just say, we are trying to see, we are trying to assure you, we are assuring. And please, politicians, stop using, I will assure you. Remove, we will ensure from your dictionary. What's the other one they use a lot?
I assure you.
I assure you. There's another one they always use.
We are working on it.
God bless you. Please, remove those phrases from your vocabulary. Just so we are done with it. You know, tell us we are tired. Don't tell us we are working on it. I can assure you.
Fresh thinking.
Done. Yeah, fresh thinking.
We need that, because just at this stage, we've had a few people who have brought on ideas that we think this will be fantastic, giving our own unique situations. Yeah. We're talking mobile clinics. We're talking phones that are able to take some of the data, and a doctor somewhere can at least give you basic treatments. Exactly. So when we sit down at a table to discuss health sector,
in England, during the COVID, the doctors were not seeing you. They were talking to you on the phone and treating you,
Technology.
You know, that's... But I was also going to say, I know a lot of doctors who have tried to come home and they have been frustrated by the system.
Absolutely.
Yeah, and they just go back because when a system doesn't work, it doesn't work.
That's true. So that's why we need to deliberately create a system, a scheme that is created for them. They know that once I come and apply this, I'll get a house, I'll get this amount of revenue, this is what I'll be, something that gives them...
the doctor that has lived in America, if I say you should please enter one of the villages in Jalingo,
they'll be happy to.
They're
the ones that would want to, because they've seen the life, they've lived, they've had their children at university, they're done. They've lived life already. If you are
paying them well, and if you are ensuring their security...
There's nothing that Nigerians give them that they don't already had.
My family want to live in Lagos,
it's the same mentality that when you live abroad, you come back home and you're like, I want to live with my people. I want to stay in the villages. You want to come and stay. When Nigerian sun hits you, you have to find yourself back to Ikoyi. But you come in, my people, Nigerians and Africans, we're here together.
But you see, by moving somebody to a village, you will ensure that you start to do that village up. So that village too will get a better life.
So the
development will start from there. Because you develop, like when they used to do the village headmaster, the headmaster's house was always the nice house.
Ecosystem starts to build around that.
Everything would start to build around it.
We have to wrap up.